organizing this event, which is going to be a big success. I wish all success to the event too. Thank you.
Thank you, sir, for your insightful address and for sharing the vision of the National Health Authority. Your guidance and continued support are invaluable as we work together to strengthen the digital health ecosystem and advance the implementation of the Ayushman Bharat digital mission in our state. The success of the Ayushman Bharat digital mission depends on strong leadership and commitment across the health sector. The leadership and initiatives that our Honorable Health Minister has championed have paved the way for a future where every citizen can hope for a healthier and a more prosperous life. Sir's commitment to public health is highly commendable, particularly through his key digital initiatives implemented in Goa. Under his dynamic leadership and visionary guidance, the state of Goa has taken significant strides towards transforming healthcare through technology and innovation. Some of them include Goa being the first state to deploy AI-powered lung cancer screening across our public health facilities, AI-enabled breast cancer screening for early detection of breast abnormalities, telecardiology and STEMI workflows, digital X-ray services with teleradiology support, telemedicine and e-Sanjeevani consultations, connecting patients with specialists without the need for long-distance travel. We also have our first digitized primary health center at Kurlim, which was also digitized under Sir's guidance. Under Sir's guidance and constant support, Goa has also achieved a milestone of over 10 lakh registrations for the ABA. As we stand at the threshold of this inaugural event, it is with great honor and anticipation that I extend an invitation to our distinguished Honorable Minister for Health, Shri Vishwajit Rane sir, to share his vision for the state of Goa. Sir.
Good morning to all of you. Today, before acknowledging all our dignitaries on the dais who have come specially here to Goa for this workshop, I would like to wish all the doctors present here happy Doctors' Day. Wish you all the best, because without you, all this is not, I mean, we cannot have any kind of discussion. And it's all of you that are actually saving lives and continuing to save lives. Present here today amongst us, who has specially come from Delhi, is Sri Sunil Kumarji, who's the CEO of National Health Authority. We also have our Secretary Health, Sri Mararkar. We have our Sri Pankaj Kumarji, who's come here, Dr. Pankaj Kumarji, Dr. Piyush Singla, Dr. Kedar Raikar, our own Director Health Services, Dr. Rupa, and all of you present here and all the doctors present in the audience. Our ex-Director Health Service, Dr. Rajnanda, who has been with me. That's why I was just telling Sunil Kumarji about my journey also as a health minister. And I was fortunate to have this portfolio for the last 16 years plus. All of you must have heard Sunil Kumarji mentioning about the importance of digitization. And I got along. I told our office to send me input, like, what is the workshop? So I got everything. But actually what you and we were just discussing, I was just discussing with them, is that we, being a small state, we should actually lead by example. Digitization of records is so important. And I was just mentioning in the lift that I generally used to go and do earlier, I used to go and do all my health checkups in Singapore, and somebody had suggested when I was there was some issue which I had gone with a relative, and then how the digitization is so important and how it helps the doctors actually bring in more efficiency in the system. Honorable Prime Minister of the country, Modi ji, is very clear that digitization of these records and mapping of the population, if it has to happen, in order to ensure that we are in a better position to, use our knowledge, diagnostics. We all say that there are so many things and so many levels. I think Mr. Maralkar visited. I couldn't go to the function recently. Actually, I was supposed to go with him when Nadda ji had this, the Arogya Setu 2.0 was launched. I only want to say one thing, is that we have been doing what we can in the state of Goa, and there's lots more to be done. when we invite, we have the private sector also in the state of Goa, which is we are working very closely with. But then digitization of the records, and if we are able to have all of them on board, and for that, to get all of them on board, I think first the state government, and not only like you said, Sunil Kumarji, is that not only the North Goa District Hospital, but all the district hospitals, Goa Medical College, and all the peripheral PHC and CHCs, if we are able to integrate, it is going to make life easy. Like just now Sunil Kumarji mentioned that we have a parallel manual system and we have the digitization. Then the pharmacy. Then you can combine and you can actually, since this is a workshop, I'm just going into one subject. Suppose we in the state of Goa, Sunil Kumarji, must be the only state that we give treatment protocols beyond your insurance card, or going beyond. We give most of the things free of charge to patients. We don't charge anything, neither during COVID and neither today. Like we have actually mapped the population in segments. What you were just mentioning, I was just listening to your speech, is like having an overall mapping of the population so that we are able to identify what are the areas of concern and how. And for this, if digitization is not done, and also doctors sitting here in the audience, actually, I have not got an opportunity to meet Sunil Kumarji in Delhi. I think my Delhi trip is overdue. Everybody is complaining. My ministers are complaining. Aap aate nahi. You're not attending the any program in Delhi. But I think I'll come call on you. It is important to sit with you to understand what way we can move forward. That's why I was just mentioning. Like I was just told that Bihar has digitized all the records across the board. Then this is an amazing thing. Just imagine a state like Bihar digitizing all their records. We are saying that we have registered 10 lakh people and digitized and given ABA cards, but that is not enough. How are you going to utilize this data? How are you going to have a seamless approach in seeing that the patients coming from the PHC or CHC or even a sub-health center to the Goa Medical College for tertiary care, how this seamless information can be used by the doctors? A poor man, a poorest man coming from the rural area should have that card which has all his records, so the doctor doesn't have to ask anybody or go and send him to do multiple tests, but he has that information and he can have a focused approach in treatment protocol as far as to give the patient. Today, I just want to tell all the doctors, it's not far away. I was telling Mr. Maralkar, he said, no, we require funds. But let me put it in this way, that when a visionary Prime Minister of the country, Modi ji, is very minutely, actually when he started his tenure looking at the smallest thing which we didn't think was very important in our daily routine and lives. Today, the whole country is looking at all programs. Each and every program initiated by him today is a success story. And I'm just starting, it is not related to health, but something like a Swachh Bharat, trying to change the overall mindset to digitization of records and having a seamless crossover information across the state in the government healthcare system will only help the doctors work in a much more efficient manner. Then you don't need to give prescription, you don't need to do anything. There'll be commons, so everything will be linked to a digital dashboard which you'll be able to utilize. You'll find out what is happening. Your blood records of a particular PHC, CHC will also be on, and you can draw information from wherever you want. I know it is a very sense. Many times we were just saying that, it is important for us to see that we move in that particular direction. And for that, the doctors sitting here in the audience, I mean, doctors sitting here, like I was just now, somebody mentioned, is that there are a lot of people who have been, facilitators of technology, and talk to them and see ultimately what you want. You want a good company, or you want a good facilitator to help us implement the type of technology that you have been implementing in other states, so that we are also able to pick up the right type of partner. Many times I was just mentioning to Dr. Saab is that lot of people come and quote for these tenders. We don't know whether they're in a position to actually deliver or they're not. That's why I said that, if we have a time-bound manner in which a small state like Goa, for us, we are in the vision of the Honorable Prime Minister. Nadda ji is also there. Fortunately, I had the opportunity to work with Nadda ji even when he was a minister earlier. And I have had a very good relationship with him. He has always given me good ideas how to move forward. But it is also for us at the state level to see that we are able to take this Ayushman Bharat digital mission forward. Whether it's the pharmacy where Mr. Rataboli is sitting from our Goa Medical College, or what are the medicines available there. A doctor at the tip of the finger can always make life easy, not only for himself, but also for the patient. And also at the state, we are doing so many programs, but we are doing it in various segments. And what just now Dr. Sunil Kumarji mentioned, is that the national authority, we are so grateful to them because of their guidance, but also what he just mentioned is that you will be in a better position to assess and bring in efficiencies of system and map the population across the state of Goa and then understand what you need to do as a state and accordingly tweak your policy and move forward. I just want to give an example is when I was in Singapore, I went to Mount Elizabeth and Mount Elizabeth has my 16 years records and they have a graph which generally tells you exactly how you've been, what is your overall wellness, what's your parameter, what was your triglyceride 16 years back and what it is today, how your life cycle has moved. Today, medicine is going beyond medicine. People are talking of regenerative science, regenerative longevity and several things, and today people are wanting to actually reduce the cell age. And so I'm just trying to tell the doctor that medicine is becoming such a vast and such a, I was told in Dubai, sir, is that now there's a longevity protocol, longevity ministry, which has now been formed, basically only to deal with longevity. So basically what we want to do, we are not saying that we want to have a longevity ministry here. We are just saying that we want to see that we are able to map the population using digital medium so that we can give him the best treatment protocol and understand his records much better, and even for the patient to understand it. Once he has a digital access to this type of, and you have access to this type of platform, it makes life much more easy. I think with the speech and the guidance given by Sumil Kumarji, I will make it, I myself will come to Delhi and sit down with you with a small team just to get an insight, how do we move forward and how do we integrate Goa as a model, and Goa can lead. We have actually done well on many parameters. And if we have to actually move forward, then I think, with your guidance and the government of India, since we are totally in sync with your vision, the vision of Naddaji, vision of the Prime Minister and the government of India. So we are all in the same thought process to achieve something and achieve something that is different and become a lead state in implementing all this. Actually, I was surprised when Dr. Saab just mentioned that, Bihar is fully has been digitized. Then I think we need to fix a time frame to see that all our PHCs, CHCs, sub-health centers, all our facilities are in sync and we are able to move forward. This will only help us. And Ayushman Bharat and the digital mission as launched by the Honorable Prime Minister is with a vision to bring in more efficiencies in the system. And I think these efficiencies will come and help us understand our state much better when we are in a position to implement it 100%. And I think we will implement it 100%. Mr. Maralkar is a little worried. He always is a little worried and stressed, I think, about the funding. इसलिए मैंने सुनील कुमार जी को बोला कि गवर्नमेंट ऑफ इंडिया से link it to some scheme where you tell them that the state government will be allowed to access these particular schemes only when you're 100% digitized, and some sort of a directive should come. And states like us will fall in line and make sure that we are able to take this forward. I don't want to say much today. We have got a cabinet meeting. I'm already delayed for the cabinet meeting, but I said this is also important. Aap aa rahe the, so I said I had not got an opportunity to meet you. And important for us as a state, and I can only commit because we as a state are very progressive and we are grateful to the National Health Authority for guiding us from time to time. All our officers always are present for every interaction under NHM or anything that is called for by Government of India to see that Goa as a progressive state goes ahead and we are able to achieve the whatever you suggest to us, and we want to move forward in that particular manner. I would like to thank you for being present here today, Sunil Kumarji, and your whole team, and our Director Health Services, who without fail attends every meeting. And even if I am not there, many times I am excusing myself these days, but I think he's been attending, just getting a different insight to how health is. And I have been fortunate being the health minister for the last 16 years has given me at least that I've been able to keep policies in sync and move forward. And I have been very fortunate to work with Naddaji in the past and today also. And I assure you that Goa will follow the guidance, and we are grateful to the National Health Authority. And if there's any other way you want us to link us or make suggestions to us, and even the facilitators that are here, the technology people who actually are here, who have actually dealt with other states, I think Secretary can interact with them, Director can interact, Dr. Kedar is here, all of them can interact with them, and then we'll be able to take things forward in a better manner, because we are such a small state. We are smaller than a district of, if you look at a state neighboring to us like Maharashtra, if you look at it, our state is smaller than any big district of Maharashtra. And it will not take time for us to integrate and have an integrated system and have this implemented in the most efficient manner and a most transparent manner. Thank you, and wishing you all a happy Doctors' Day again today. And I want you to all the doctors, please understand, a minister only cannot take decisions. I always have this discussion. Minister is not only to take decisions, suggestions should come also from the doctors' fraternity. And doctors also should make these suggestions because you are working in the system. And we are here to hear you, and administratively, whatever we need to do, we need to work with you and ensure that we have an efficient system and efficient platform in place. And also, the private sector should join us. And I appeal to them also to be a part of this system so that we're able to work in a very integrated manner. Thank you so much.
Thank you, sir, for your insightful address and for highlighting the state's commitment to advancing digital healthcare. Your dedication to health is truly commendable, and we are fortunate to have someone of your stature contributing to the success of Goa. We are grateful for your continued leadership and commitment to improving healthcare in our state. Your guidance and encouragement will undoubtedly strengthen the implementation of the Ayushman Bharat digital mission across the state. I extend our sincere gratitude for your time and your genuine commitment to make today's event a truly memorable one. We now have a small memento as a token of appreciation from the National Health Authority. I request all the dignitaries on the dais to kindly assemble for the official group photograph.